Hey, my name's Jordan Phelan. I'm going to talk about why to pursue a career as a nurse. According to Johnson & Johnson from 2014, nursing is the fastest growing occupation in the U.S. Nurses make up a majority of the healthcare industry. Nurses have a wide range of responsibilities. They assess do patient assessments, they check patient vital signs, they administer medication, and they also implement critical thinking skills, just to name a few of the responsibilities nurses have. So, nursing is a great career to choose. Hey, my name is Jordan Phelan. I'm going to talk today about why to pursue a career as a nurse. According to Johnson & Johnson, nursing is the fastest growing occupation in the U.S. Nurses make up the majority of the healthcare industry. Nursing is a really great career to pursue. Nurses have a wide variety of responsibilities. They administer medication, they do patient assessments, they assess patients' vital signs, and implement critical thinking skills, just to name a few of the responsibilities nurses have. First off, nursing is a very rewarding career. Just a few qualities that define a nurse would be that they are caring, compassionate, and empathetic. They take care of a bunch of patients on a daily basis that usually don't feel real well and they're not at their best. So these patients really want someone who's going to care about them and care about the type of care that they receive. Think about the typical work attire. When you typically think about something someone wears to their business, you think about a suit or a dress outfit, or really uncomfortable shoes like these. But with nursing, they usually can wear scrubs. I have a scrub top right here. And it's basically like wearing pajamas to work. And you get to wear really comfortable shoes. So this looks a lot more comfortable than this. Nursing is also a very high-paying career. Nurses are one of the highest-paid professions with associate's degrees, according to CAPS in 2014. There also is a lot of flexibility with nursing. First off, there's flexibility with your schedule. There's a whole bunch of things you can choose from like how many days you work, such as there's 3 12-hour shifts you can choose from if you want to be full-time, which is really nice because you only have to work 3 days a week. Not too many people can say that they work just 2 days a week, or 3 days a week, sorry. And you could also choose 5 8-hour shifts if 12-hour shifts just isn't for you. There's also several opportunities where you can pick to be on call at some places, and that gives you a little extra money, and especially if you get called in, you usually get time and a half. And there's also PRN, where you can just work as needed at a place. So you may not want to work full time. You can just work as is convenient for you. And there's also usually a day shift and a night shift you can choose from. So if you're a night kind of person, then you could choose a night shift. There's also flexibility in where you work. There's several different settings that you can work in. There's hospital settings, and they have a bunch of different areas that you can specialize in, such as you could work at labor and delivery, so you could work with delivering babies. ICU, if you want more critical patients or a little more challenge, then that would be a good area. There's also the ER, which is a wide variety of different things that come in to deal with. There's also dialysis patients whose kidney functioning isn't that great. They'll come in for dialysis. So there's dialysis nurses. There's also different settings other than hospitals. You could work at a doctor's office, different kind of clinics like acute care clinics such as Apple Care or the MedStop. And there's also home health, which is getting to be a really big thing, where they require nurses to go out and take care of these patients because patients like to go and be taken care of in their home now. So, and there's also several career paths as well. So you could be a regular registered nurse and with an associate's degree or a bachelor's degree, or you could go back and further your education and become a nurse practitioner or a nurse educator or a nurse manager. So the opportunities are endless. It makes nursing really an ideal profession because you can really go into any kind of specialty. You can work towards whatever works best for you. You can tailor that around your lifestyle and whether you want to work nights or days, if you want to work 12-hour shifts or 8-hour shifts, or if you want to just work 3 days a week or 5 days a week. So it's really nice that way. Also, nurses are pretty much guaranteed a job. According to Rossiter in 2014, there's a growing demand for nurses. This is due really because of the older nurses are starting to retire. There's not enough new nurses coming in to take their positions. There's not enough nurse educators to teach these nursing students so that they can get into the field. There's also a big influx of patients because of the baby boomers. So there's a lot more patients getting older, needing more care. So it is really important to recruit nurses and get them to going into school so that we can have more nurses and more nurse educators. So it's really evident that nurses have a major impact on healthcare. So think of pursuing a career as a nurse. It is one of the most rewarding careers available that provides the most flexibility.